Good afternoon and welcome to Open Classroom. I'm Janet Gillow, Director of Professional Development for the Brown School, Washington University in St. Louis, joined by my co-host, Tiffany Phillips, who's our Communications Manager. Welcome to Open Classroom. Throughout this webinar, the audience is muted. We can't see or hear you, but we love to have your questions about the program today, your comments about it in the chat. So please do use that to become part of the program today. We're certainly grateful that you're here. These virtual events that give us an opportunity to connect with each other during hard times for our country and our world. It also gives us the opportunity to wish you a happy Hanukkah or a Merry Christmas as that applies. Before we get started today, I just want to let you know what we have coming up. On Thursday, so in 2 days, also at 12:30, we have the third in our installment in the series, Adaptive Coping and Relaxation Skills for Health and Public Health Workers. So still opportunities to register for that if you'd like to. Then we're going to take a 2-week hiatus for the holidays, and we are bringing Open Classroom back in January. Our first program of the new year is on January 5th. So now it's my great pleasure to introduce today's speaker. Cheryl Whelan has over 20 years of professional experience in the fields of education, disability, and LGBT older adult advocacy. She's currently the Director of National Education Initiatives at SAGE, where she directs the operations of programs such as SAGE Care and the National Resource Center on LGBT Aging. Cheryl began work with SAGE at the local level here in St. Louis in 2008 and became a certified trainer in 2011. Prior to joining the SAGE national team, she successfully led the merge of SAGE St. Louis and the Missouri Statewide Equality Organization Promo Fund. We are proud to call Cheryl a member of the Brown School family, a 2008 alum of our Master of Social Work program. Please welcome Cheryl Whelan to talk to us about the pandemic and social isolation, considerations to support LGBT older adults.
Thank you, Janet and Tiffany, for inviting me to be a part of this Open Classroom today. I'm really excited to join you all. I'm excited to see so many people from across the country joining us for this Open Classroom. And, you know, as we go through the presentation today, I welcome folks to ask questions in the chat. And Janet and Tiffany, feel free to, say, Cheryl, we have a question. And I'm happy to have more of that ongoing dialogue with folks as we go through the presentation today. So with that, I'm going to get started. And I wanted to start by first just sharing a brief overview of SAGE. SAGE is Services and Advocacy for LGBT Elders, and it's the largest and oldest organization dedicated to improving the lives of lesbian, gay, bisexual, and transgender older adults across the country. It was founded in 1978 with headquarters in New York City. And we offer supportive services, consumer resources through programs such as the National Resource Center on LGBT Aging, supports and services for caregivers, and we advocate for public policy changes that address the needs of LGBT older people through our technical resources, the National Resource Center on LGBT Aging, as well as our cultural competency program, SAGE Care. We have offices in New York City, Washington, D.C., as well as a growing network of affiliates across the country, including SAGE of Promo Fund here in Missouri. So SAGE, we like to say that we're the aging voice in the LGBT community and the LGBT voice in the aging community. And with that, I'd like to go to our first poll question. I oftentimes start presentations by asking people, do you know or currently know an LGBT older adult, or do you work with an LGBT older adult? And we'll take a few minutes for folks to answer. I love watching the poll results as they come in to see the numbers changing and shifting as we go through. It's looking like the majority of folks do know or work with an LGBT older adult. A few people have said no, they don't know an LGBT older adult or are unaware. if they know an LGBT older adult. I oftentimes ask this question because when I started the work in St. Louis by founding the SAGE affiliate program here in St. Louis, I would go into the community and say, I'm going to start a program to serve and support LGBT older adults. And oftentimes people would say, you mean we have LGBT older adults in St. Louis? And I would have to laugh. I see Janet kind of chuckling and Tiffany chuckling as well. And I would actually stop myself and laugh as well, because I'm really not sure what people thought, that we turned straight at 65 or we all moved to Florida. Those were the only two answers I could come up with. And, you know, reality is we have LGBT older adults that are residing in communities across the country, large and small. But what it really speaks to is that invisibility of LGBT older adults. And as we think about just the concepts of social isolation and loneliness, that invisibility leads to social isolation and loneliness. So if we're not recognizing that we have LGBT older adults in our community and that we serve LGBT older adults on a daily basis, then it's really easy to see how they become invisible. So this is always a question that I like to ask as you know, I start out presentations. Let's go ahead and jump to the second poll question.
Cheryl, we had a quick question in the chat.
Oh, yes.
We're asking about the threshold of older LGBTQ people. So when would someone be considered older, I guess is the question.
So I've often said that, you know, age is really it's a construct, right? We have the biological age, we have, you know, the age that we identify with every day on our birthday. But the aging process really has to do more with, you know, our health and well-being overall. So I've always been kind of hesitant to assign an age to what SAGE age means. But for a lot of folks, we look at 50 and older as being the age that is SAGE age. But then we also know that people with disabilities and other chronic illnesses may be aging faster, you know, as a younger person than a healthier older person. So a lot of the things that we talk about and the services that are available are really available to all people, regardless of their actual age. Does that help? Okay, great. And there we go. I was having trouble getting my slides to advance. So let's go ahead and go with the second poll question. How do you describe yourself? And our options are LGBT older adult, a friend or family member of an LGBT older adult or a caregiver, an aging professional, a university student, an interested community member, or other. And if you choose other, please go ahead and list it in the chat. So we'll give you a few minutes to answer this poll question. And again, it's great to see the diversity of answers that are coming in. Looks like the majority folks are aging professionals. And then the next group would be interested community members, friends or family of LGBT older adults. And then we have a number of LGBT older adults themselves who have joined us today, and we're excited to see that and hope that there's information that you can take away from this presentation to share with your friends and colleagues in your networks. So as we continue to think about our presentation today, I wanted to start by just giving a little overview of what we know about our LGBT aging population. And just as the overall older adult population is growing, so are the older adults who identify as LGBT. SAGE estimates today that there are upwards of 3 million LGBT older adults over the age of 55. and that by 2030, this number could grow to 7 million. And we know today that LGBT older adults reside in communities large and small across the country. In fact, the 2010 census found same-sex couples in over 97% of all counties across the United States. So when we talk about social isolation and the need for LGBT welcoming supports, our concerns are not only for large metropolitan population centers, but even more critically, the needs that are found in rural and more isolated communities. And so a lot of what we're going to talk about today are resources and strategies that can be shared across the country, regardless of where a person lives. With the SAGE headquarters in New York City, our offices across the country started preparing for COVID early on because New York City became an early epicenter for this crisis. And part of this preparation included developing and sharing resources with our constituents and community partners. Through the National Resource Center, which you can find at lgbtagingcenter.org, we populated a page dedicated to COVID-19 resources. And one of the first things we prepared was a tip sheet on preparing for COVID-19. And this listed some of the early information that we knew about COVID in an easy and accessible format for LGBT older adults that was shared across our networks and is available today as well to continue to share. We also developed more of a live page for COVID-19 resources, where we shared links to other organizations such as CDC and the Administration on Aging and the National Council on Aging to share some of the unique resources that were being developed specifically for older adults. We also recognize that many of our LGBT older adults were already residing in long-term care communities and in nursing homes. And we knew that this was also one of those early epicenters for the COVID illness. And so we wanted to make sure that our LGBT community members in long-term care communities knew what their rights were as LGBT older adults. So we wanted to highlight this resident rights and the LGBT community fact sheet on this website. And then the other resource that I wanted to highlight is a document called My Personal Directions. And we've probably all heard of the need for long-term care planning documents, durable powers of attorney, a living will. Those are all important legal documents that we need to have. But what gets missed in some of those legal documents are our day-to-day needs and desires. And that's where this personal directions form really comes in handy. It was developed in partnership with Consumer Voice. And we took the time to add an LGBT lens to this document. So people could not only share, who was going to be making medical decisions on their behalf, but what their day-to-day needs were. How do I want to dress on a daily basis? What type of foods do I like? What holidays do I celebrate? So this was a really important document and continues to be an important document for LGBT older adults and all older adults to have, should they go into a long-term care setting where their wishes may not always be recognized or supported. So these are just some of the resources that we made available early on during the pandemic. And this quote here is one that I want to share now, and then we'll reflect on again towards the end of the presentation. But, as we continue to navigate this global pandemic, we're reminded daily of the isolation and unique needs that our community of LGBT older adults experience. Our response to COVID is one that's required flexibility, innovation, and new approaches to challenges that we face. So what are some of those challenges? For minority older adult populations, including those that identify as LGBT, the daily struggles to overcome discrimination and stigma has only been exacerbated during this COVID-19 pandemic. And this is especially true for Black, Indigenous, and people of color who also identify as LGBT. The intersections of aging and other minority populations really starts to exacerbate how we experience day-to-day life. And then you add the pandemic on top of it, and these barriers and stigma, even become more keen as we look to the services that we need to be providing. So, some of what we know is, that we've worked long through LGBT aging to address social isolation and loneliness. And factors that contribute to this social isolation include LGBT older adults being less likely to have children and more likely to live alone. And during the pandemic, when older adults have oftentimes turned to family to provide help with shopping and running errands, many LGBT older adults have lacked these natural support systems. And this is a question that has long been asked in the communities that I've worked with. Who will be here to support me as I age? And oftentimes, LGBT older adults find themselves relying on chosen families. And these chosen families are oftentimes made up of same age peers. During a time when older adults are among some of the most at risk, these systems become even more fragile at best. And I've seen this very scenario play out in the community that I'm connected to here in St. Louis, where many of our older adults rely on other older adults for their friendship circles, for helping them get to medical appointments or celebrating holidays. And when older adults have had to shelter at home to remain healthy and safe, these support networks have shrunk. And so who is there to support our LGBT older adults? Part of the presentation today is to invite you all to be a part of those support networks for our LGBT older adults. We also, as we talked about earlier, we know that many of our LGBT community members have already been residing in long-term care communities. Again, they have been at the epicenter and have seen some of the highest rates of infections and death related to COVID. So, we don't know right now how many LGBT older adults we've lost to COVID, but I know through all of our affiliate work and with the SAGE Center, we've experienced a lot of loss in our communities, and many have resided in long-term care communities or other, senior communities across the country. So that, continues to be a concern for us today. Additionally, we know that LGBT older adults have had higher rates of health disparities. And one of the complicating factors with COVID is pre-existing conditions and health disparities. So again, we're at increased risk due to some of the pre-existing conditions that we know many LGBT older adults have experienced across their lifetime. And then this is further complicated by having a lack of access to LGBT welcoming health services. If you're fearful to go to the doctor and you're sick, where do you turn? So we need to continue to promote inclusive policies and practices within our health and aging service systems to ensure that they're welcoming to our LGBT older adults. And then finally, the increased risk of financial insecurity. Many of the strategies that people have been using during this pandemic include, taking Uber versus a bus. Well, if you're already financially strained, you may not be able to afford an Uber to take to the grocery store or to buy groceries or to get to your doctor's appointment. So this also becomes a concern for LGBT older adults who are facing financial insecurity. These are just a few of the ways that the current pandemic threatens the safety, well-being, and health of our LGBT older adults. So how do we respond to this need? Thank you for asking that question, Janet and Tiffany. You know, the SAGE team immediately recognized the risk of the pandemic and what it presented for LGBT older adults across the country. And during the month of March, as we started to see programs, you know, shutting down their in-office programs and so many things going virtual, you know, we had to quickly respond and think, how do we continue to connect to LGBT older adults? And so a program called Sage Connect was our response, or one of our responses. By April, we had Sage Connect up and running, and it's a phone or video call support program that matches LGBT community members and allies to LGBT older adults across the country. And I believe around 500 matches have been made to date. One of the participants in the Sage Connect program wrote that they had a lovely chat with their volunteer. I felt like I was talking to an old friend with whom I could totally be myself. I think it is so essential in these times for LGBTQ elders to have a kind, understanding person to share a window into their life. As I reflect on, I think, really one of the biggest challenges of this pandemic, it's been that sense of social isolation and loneliness. I've seen it in my own circles. I've heard it in my own family. So this idea of connecting, even to somebody you just met, can be very powerful and even life-saving. So if you know of an LGBT older adult, or you yourself are an LGBT older adult, I encourage you to reach out to Sage at sageusa.org and learn more about the Sage Connect program and how you might get involved either as a caller or someone that's receiving a call. And again, this program is available across the country. We talked about the financial insecurity as being one of the barriers. Sage Sense is another digital program that was developed in response to COVID. This is a digital wellness platform made specifically for LGBT elders to increase their financial stability and reduce the economic stress experienced by aging. This program was created in partnership with LifeSense, with the generous support from the Wells Fargo Foundation, and it helps to ensure that LGBT elders have access to resources that will support their financial literacy and stability as they navigate the unprecedented economic environment resulting from the COVID pandemic. With Sage Sense, LGBT elders will receive accurate and current information and have access to helpful resources and tools that are personalized to their age, income, financial goals, and more. This is a phone application, so people, you know, really have access to it 24/7. And again, we invite you to learn more about this program and help connect those in your circle with this very important financial literacy and education program. We also saw not only the programs in New York City, but many of our affiliates, you know, needing to adapt and adapt quickly. So some of that adaptation included shifting their programs to a completely virtual environment. You know, I would say by the end of April, everybody was using Zoom, and you know, we all have Zoom overload right now because so much of our day-to-day activities are happening through Zoom. But it's also been, you know, that window for people and that opportunity to stay connected with one another. And so some of the examples of programs that have been happening virtually, have included support groups, caregiver support groups, grief and loss support groups, exercise and art classes, case management visits. And many of the congregate meals couldn't go virtually because we haven't figured out how to like Zoom a lunch to somebody yet. But we have been seeing programs shift to home delivered meals as well as curbside pickup meals. And again, if you know of LGBT older adults or straight older adults in your circle, encourage them to reach out to their local area agency on aging, to their SAGE affiliate, to other community programs that support older adults, and see what programs they have available in a virtual environment. Because this really is, like I said, a lifeline for so many people to stay connected. And more older adults are using technology today. So, we shouldn't be afraid to enter into this environment of virtual programming with and support of older adults. I'd also just like to briefly mention, I mentioned grief and loss. If anybody has an LGBT older adult in your immediate circle who has lost a loved one during this pandemic, I know of a 14-week grief support program that's going to be taking place remotely. So feel free to email me afterwards and I can send you some specific information on that program. Because I know that that's one of the requests that I often get are for grief and loss programs. And again, this is even, I think, a more critical need right now for so many of our LGBT older adults. Another program that I wanted to highlight today is our SAGE National LGBT Elder Hotline. This is also a program that I most recently started managing for SAGE National. And it's in partnership with our United Way Worldwide. And we partner with one of their 211 centers in Broward County, Florida, to host this 24-hour, 7-day-a-week hotline. And, part of our mission behind the hotline is to provide an opportunity for LGBT older adults to talk and be listened to through this LGBT SAGE hotline. We connect LGBT older people with friendly responders who are really there to listen and to hear what their needs are concerns are. The hotlines are managed by a certified crisis response team. They offer support without judgment. They answer questions factually and confidentially. And they provide information about community supports and resources at the local level and help make sure that people are connected to things such as healthcare and transportation, counseling services, legal services, and emotional support. The program is available 24/7 with English and Spanish translations, as well as a contract service that can translate into over 180 languages. So we've really tried to make sure that this program is accessible to folks, really across the country. Members of our community are likely to live alone and feel isolated. So this hotline, again, can be a critical resource for folks when they most need it. And we encourage people, again, to share information on the hotline. I wanted to highlight just how much we've seen the response and the need grow over the past 6 months. This is a fairly new relationship for SAGE, and so we've really been trying to message, on an ongoing basis about the availability of the hotline. But since the pandemic started, we have seen a huge increase in the number of calls. From April to September, we saw 439 calls compared to 189 calls the previous 6 months. So you can see just how much that jumped. And the majority of the needs being addressed through these calls have been related to mental health concerns such as depression and anxiety related to loneliness, the pandemic, so many things that people are experiencing right now. They've been able to connect people to counselors and support groups in their local communities. They've also seen people, calling for COVID-related healthcare needs and stressors. And in addition, other categories that they've been helping connect people to include basic support needs such as housing and financial assistance, legal issues, as well as other healthcare related concerns. A survey of the people calling the hotline found that 95% of the callers indicated an overall positive satisfaction with the person that they were able to talk to, as well as the resources that they received. And this word cloud that you see on the PowerPoint really describes the words that have been used by the folks that have been surveyed. And some of the things that really stand out include empathy, connections, listening, and compassion. And during this pandemic, I can't think of more powerful words than those: empathy, connections, listening, and compassion. And in the words of one of our SAGE participants, it's always nice to have someone to talk to, someone who truly understands understands you and where you are coming from. And that's why, this hotline has been such an important program for our LGBT older adults across the country, as well as their caregivers. We encourage you again to share this information and to help make sure that people are connected. So as we go into the final part of the presentation today, I wanted to spend a few minutes really just looking at what are some of the collective action steps you can take as professionals, as organizations, as well as individuals. So as a friend, family, or an ally, think back to how many of you raised your hand when I said, do you know an LGBT older adult, or do you work with an LGBT older adult? Here are some things you can do to help them during this pandemic and help them lessen the experiences of social isolation and loneliness. It starts simply with reach out. When was the last time you picked up the phone and called one of those older adults in your circle? When was the last time you sent them an email and asked, is there anything I can do? Is there anything you need help with? Can I drop off groceries on your porch? What are you doing for the holidays? I'm cooking a meal. Can I bring you, a box dinner? How can we reach out and make sure that people are feeling supported and connected? And secondly, stay connected. Set up a time, for a regular phone call with the LGBT older adults in your circle. Send an email, send a holiday card, send a greeting note, and encourage them to sign up for programs such as Sage Connect, and let them know about the hotline so that they have resources that they can reach out to. Assist with planning. So many folks maybe haven't really thought about who their emergency contacts are. And during this pandemic, we really need to have those folks identified. Do people have durable powers of attorney? Have they designated someone who is their emergency contact, or do they have somebody that's checking in? If we call and we aren't able to get a hold of them, do they have somebody that can go by their house and make sure that they're okay? It's really important that we're reaching out and helping people with these types of planning activities, especially during a time of crisis. And it looks like we have a hand that's been raised. I don't know if Janet and
we are not able to call on people for raised hands. Please throw your questions and comments in the chat, and we will bring you into the conversation.
Great, thank you. There's a number of planning resources available through the LGBT Aging Center, and I've listed some of the the direct links here on this PowerPoint today. And you can also email me afterwards if there's additional resources that you're looking for, and I can help, point you in that direction. And again, as you're thinking about assisting folks with planning, encourage them to reach out to their area agencies on aging. I've heard from folks who felt guilty signing up for home delivered meals, but that's why these programs exist. Home delivered meals are there to support the nutrition needs of older adults and all older adults. So if you know of somebody who is aging or living with a disability, encourage them to sign up for home delivered meals, because nutrition is so important, especially during, times like we're in right now. And consider volunteering. If you're the type of person that enjoys giving back, see if you have a local SAGE affiliate. See if you can volunteer with them. Talk to your area agency on aging and ask if they have an advisory council or a board that you can serve on, and serve as an advocate for the needs of LGBT and other minority populations. Call up the local senior center, see if they need help with home delivered meals. So many of the congregate meal settings are relying on drivers to do home delivered meals and curbside delivery. So there's a number of ways that we can get involved in a way that's safe for ourselves and really helps to reduce that isolation of others. From an organization or professional standpoint, what are some of the things that you can do? I encourage you, if you've not done it already, assess your own organizational policies and procedures. LGBT older adults and the LGBT community at large, we've learned to really look for LGBT inclusive messaging. If you don't have inclusive non-discrimination policies, then, for many of us, that's a sign that we may not be welcomed in your program. So as you think about reaching out and serving minority communities, make sure that your policies and procedures address diversity, equity, and inclusion. And make sure that those statements are visible on your websites, visible on your brochures, and that you've also provided training for your staff on issues around diversity, equity, and inclusion. Creating those safe spaces are critical when we're trying to do outreach to vulnerable communities. Develop outreach plans. I oftentimes would have people ask, well, where do I find LGBT older adults? Well, where are you doing outreach in general? If you're going to a farmer's market and doing outreach, or you're doing outreach through a local church or other community organizations, you're also reaching LGBT people. So make sure that your resources are welcoming and open, and then you'll also be reaching LGBT older adults in those same venues. If you have an LGBT community center or SAGE affiliate, look at ways that you can partner with them to help promote your programs, to help fill gaps in their existing programs, and to continue to build collaborative opportunities that promote LGBT inclusion today and in the future. And I think one of the things that we're just really starting to think about now is, what is our messaging around vaccination campaigns? And do we have messages that are inclusive of minority communities? Many of our minority communities have not had good experiences within the healthcare system. So it's important that we're developing messages that have spokespeople that represent the communities that we're trying to reach, and that we're creating messages, along with health professionals around, the need for the vaccine, as well as preventative steps that still need to be taken after people receive the vaccine. So think about ways that you can start to do some of this work today. These are all some of the steps that I identified, for our presentation today, and what we do today can really help us to continue to be stronger together. And again, I think what we've learned through this pandemic is that we're at a time when, we have to be flexible, and we're finding new ways to innovate and finding new approaches to address the challenges of isolation and loneliness, not only within the LGBT community, but really with all older adult communities, across the country. So I just want to thank you for your time today. And I believe we have a few minutes. If there's questions, I'd be happy to answer any questions that you may have.
Cheryl, thank you so much for that amazing talk and all of that wonderful information. It's just so nice to have a place to start, because a lot of times people, they want to be helpful, they want to be an advocate or an ally, and what will stop them is just feeling like there's so many places that they might look for information that they get paralyzed. So I think this is a great resource. Everybody, we really want you to go ahead and join into the conversation. Please go ahead and put your questions in chat. And while we're waiting for you to start typing, I do have a question for you, Ms. Sherrill. As I was listening to you describe how needs have skyrocketed during the pandemic, it reminded me of some other things that I've heard from researchers at the Brown School about skyrocketing calls to 211. Mm-hmm. So if you could tell me if you have a relationship or are people who are LGBTQ who call in, are they referred to specific resources for their populations when they call into 211?
I think that's a great question, Tiffany, and each 211 system has done outreach in their local communities. I know that the SAGE affiliate in St. Louis and more than likely the LGBT Center in St. Louis has been connected. Through our hotline, as I mentioned, it's ran by the 211 out of Broward County as part of United Way Worldwide. And they've made an effort to ensure that that hotline is also linked to all the 211s across the country. So hopefully folks are getting, the appropriate information through those 211 systems.
I do see that we have a question in chat from Sarah Engel. Are there resources or ideas for working with LGBT aging adults who are suffering from depression? Mm-hmm. Medication and psychotherapy, but is there anything else that proves helpful or effective?
So I think that's a very good question. And I think part of, taking part in support groups and some of the virtual activities can definitely help lessen the impacts of depression and anxiety. And, so encouraging LGBT older adults to get involved with programs that are available, I think is key. I've not seen any support groups that are available virtually right now specific to those needs. But like I said, we are seeing more things like the grief and loss support group.
I did want to bring something else up while we're waiting for more of your fabulous questions in the chat. I noticed today on St. Louis Public Radio that there was an announcement of a housing discrimination settlement. There was a lawsuit that was brought by an LGBT couple who wanted to live at Friendship Village, and they were not allowed to. They ended up having to sue, and that's been something that was just settled. So it reminded me that when we talk about isolation, a lot of times people who are older, they want to move from their houses to a community so that they're able to more easily do things and not have that upkeep. And it's kind of disheartening to realize this might be something that's going on across the country. Can you speak a little bit about the access for couples as they get older to these kinds of residences?
Yeah, thank you for that question, Tiffany. That was actually a case that we've followed very closely. In St. Louis, while I work for Sage National, I still reside in St. Louis. And the couple that sued are actually a known couple to many of us that work, that have worked in the Sage work here in St. Louis and in Missouri. So, the fact that case was settled, I think it does show that there's recognition that LGBT older adults do deserve access to the same resources and services as our neighbors. And, one of the biggest questions and concerns for many LGBT older adults is, where will I live should I need to move into long-term care? And for many of us, we want to stay in our neighborhood, in our community. And so access to those same communities that our neighbors have is so critical. Part of that need that has been recognized led SAGE and the Human Rights Campaign Foundation to start a new program called the Long-Term Care Equality Index. And many folks on the call today may be familiar with the HRC Equality Index, Corporate Equality Index, and the Healthcare Equality Index. This program is the next in the family of equality indexes. And so the goal of that program is to network with long-term care providers, so retirement homes, assisted living, nursing homes, help them assess their policies and procedures, and really make an ongoing commitment to inclusion for LGBT older adults. You can learn more about that program at thelei.org, or you can email me. That's actually another program that I oversee for SAGE. So it's a growing program. We have a map of communities that have already signed on, and we would welcome Friendship Village to take a look at joining the Commitment to Caring campaign through the Long-Term Care Equality Index, and working to update their policies and procedures so that they're truly welcoming of LGBT older adults, like the couple that sued here in St. Louis.
Thank you. We had a quick question from Allison Crane. Are LGBT seniors more likely to age alone?
Yes, they are. Actually, research has shown that we are more likely than our straight counterparts to age alone. And, as I mentioned, we have shrinking support networks. So as you age, if you've lost a lifelong partner, it's oftentimes harder to find companionship at an older age, and especially when you're in a community that may not have the same types of resources and connections that other communities do. So yes, we are more likely to live alone and to age as single older adults. And Tiffany, you were on mute.
I know. I was like, it had to.
Here, let me show you my mug. Just a second.
Do you have a mug that just says it? Stop that.
I don't know if you can see it.
Oh,
there we go.
Oh, cute. New Christmas present idea. So Dan Carr asked if you work with NAMI.
We work with who?
NAMI.
We do have some local affiliates that have been connected, I think, with their local NAMI organizations. And we do, always welcome those opportunities to connect more closely.
We had this thought from Sarah. As a future older LGBT adult who's been seeing a lot of this happening in our community, I really want to thank you so much for this work, Cheryl. I'm also curious if you know of any work that's been done about LGBT folks who aren't older adults yet, but who might be having significant fear about aging and the increase in structural oppression and loss of self-determination they may experience as they age.
That is another very good question. I would encourage you to look at some of the resources that are available through the LGBT Aging Center. Even though our focus is older adults, a lot of the information is really applicable across the lifespan. We have a section, just on self-advocacy. And I think that can also be a really important aspect for us to think of as we're aging, about what can we do to really empower ourselves right now. And finding a good counselor is always a good place to start as well, to kind of help people think about their own aging process and some of those fears and challenges that they may be starting to experience.
We had another follow-up question kind of related. Apparently there are some states where you have programs where you can foster an older adult who can't live on their own. And the question is, does Missouri have something like this that you know about?
Yeah, I have not heard of that in the state of Missouri. But I do know there are some SAGE affiliates that have had home share programs. And so I think there's opportunity for new models of home sharing and cross-generational support that, you know, are definitely being utilized in other areas of the country that could be a model for communities such as St. Louis.
Well, I have to say, you guys have had some wonderful questions. Please go ahead and keep those coming. We have a little bit of time left, and I definitely want you to use Sherrill as a resource.
Yeah, and I would just like to add that, you know, part of my job is providing technical assistance and ongoing information. So if you didn't have your question answered here today or something comes up later, you know, feel free to send me an email and I'll do my best to find the information for you and, you know, make sure that you have resources available.
Cheryl, thank you so much for all this information. Great resources, so many links, and lots of great questions from the audience. Want to remind folks that we can't call on you for raised hands, but we welcome you to put questions into the chat. One thing that I was curious for you to expand on, you mentioned that there were higher rates of health disparities with LGBT older adults. And I'm wondering what you attribute that to, whether it's a lack of welcome or provider bias, or what should we understand that the root cause of that as being?
Yeah, so, you know, part of the mitigating factors around health disparities, one of the bigger things is that lack of LGBT welcoming health access, which has led many LGBT folks across their lifespan to not seek preventative care. So if we're not seeking preventative care, then that increase our risks for health disparities such as, you know, drug and alcohol abuse, depression, anxiety, obesity, some cancers. You know, all of those things can just be really exacerbated because we aren't seeking preventative care. So it's really important that we have welcoming and accepting health access so that people feel more comfortable to go to the doctor, and then that will help reduce some of these health disparities.
Amen. Amen. So you mentioned that there's still an opportunity for people to become Sage Connect volunteers. This is obviously a community that's deeply concerned about the population that you serve. I'm wondering what the requirements are for those volunteers. Like, how would someone know if they're a good fit for the position?
Yeah, the requirements are really a willingness to be a part of the program. If you go to sageusa.org, there's an application that you fill out and answer, you know, just some very brief questions about yourself. And then we have a coordinator who works specifically with our Sage Connect program, and they really try to look at, you know, where the volunteer is located and how they kind of match up with the potential LGBT older adult that's seeking services, and then they make that match. So it's a 6-week commitment to begin with. And then many of these volunteer relationships continue to go on, you know, well beyond that 6-week commitment.
Very nice. So Nicole was wondering if you had any suggestions on how to guide, model, mentor, if a nursing home or care facility's policies are not inclusive, how you might encourage them to take a look at what they're doing and to be a little bit more open.
Yeah, so I would, you know, one of the best recommendations I have right now is to look at, go to the LEI website. Again, that's thelei.org. And we have a 2-page fact sheet that provides some real, I think, some of the high level information about the importance of doing this work. And then we have a brief that really helps to build the case for LGBT inclusive long-term care communities. So those are two documents that you can, download and share with the communities that you might work with. And I'm actually, let me see if I can back up a slide here. On this slide here, where it says LGBT Aging Center /guides, we have a best practice guide for welcoming communities. It's a purple cover, and you'll be able to see it on that website. It's a really good primer to take and share with organizations and encourage them to adapt LGBT inclusive policies. You can also send me an email if you know of a community that you would like to see be a part of this work, and we can maybe see if we can do some direct outreach to those communities as well on behalf of LGBT inclusivity.
Nice. Well, it's perfect that you backed up a slide because we have a question from Roger. He wants one of those masks. He's loving them. Where are they available?
Right. I think so this is from some of our SAGE constituents in New York. And I believe somebody made these masks and donated them for our constituents. But yeah, they're great masks, aren't they?
Very cool. So we had a request for clarification about the connection between United Way and SAGE.
Mm-hmm.
Just if someone calls in and they need resources and they identify themselves as LBGT, can they just do that on the 211 call and then they'll be referred to SAGE, or is there something else they have to do?
If they call the hotline that I mentioned, and I can go back to that slide as well. The joys of controlling your own Zoom slides, right? Okay, if you call the SAGE National Hotline, this number is specifically for LGBT older adults and caregivers. So by calling this number, there's an assumption that you're a part of the LGBT community as either an LGBT individual or an ally. So you could call this number and they would direct you to services in your local community.
Great. So we are nearly at an hour. There's been so many great resources, such great questions and conversation from the audience. One thing that I'm curious about for you, it seems like SAGE has done a tremendous job pivoting your programs and your models according to just an unforeseen disruption in so much of what you were doing. So question would be, of the new things you've rolled out, what are you likely to continue to do? What are some positives for the organization that this has been good learning and service expansion, not just really tough times?
Yeah, I thank you for that question, Janet. This is something I've been thinking about a lot here lately. And I would say one of the biggest takeaways is it's allowed us to think outside the box. For years, we've talked about this need for a virtual LGBT senior center. And there was always a reason why it didn't happen. We didn't have time, we didn't have funding. We have center-based programming, so how's that going to interfere? Just all those excuses that I think we can come up with. And this really allowed us to see what's possible and to see the need and the reach that we can really have through virtual programming. So, I see many senior serving organizations continuing to do virtual programming because so many folks can't have ready access to in-place programming or in-facility programming. So making more of our programming and opportunities virtual, I think, is something that we'll continue to see over time.
That's right. Well, I want to give you, Cheryl, just an opportunity for a last word. If there's a final thought or call to action or just anything you want to share with the audience before we say goodbye.
I think, again, I just really want to thank everybody for being a part of this presentation today. And, my call to action is reach out. We all know somebody in our circles, LGBT and straight, who may be really experiencing some isolation and loneliness. And especially during this time of giving, think about ways that we can reach out, with gratitude for the support that we have, for the connections that we have, and help make somebody else's day a little brighter. Again, just thank you all for being here. If there's additional resources that I can help you with, reach out, and, I'll try to connect you the best that I can. So thank you all so much.
Wise words. Tiffany, you go.
Thank you. Thank you so much. This has been so informative, and it's uplifting because you leave somebody feeling like they can actually affect the issue. So thank you so much.
Thank you, Janet and Tiffany.
Thanks, everybody. Be safe out there, and we hope to see you again soon.